The APA Foundation plays a key role in supporting mental health across the country, and it's always an absolute delight for me to hear the latest on their great work and to hear the latest on the Mental Health Care Works campaign and more. So I'm absolutely delighted to be joined by Dr. Rawle Andrews and Dr. Tina Kim, one of the Foundation's fellows. So welcome. Thank you both so much for joining us today. Rawle, can we start with the Mental Health Care Works campaign? Yes, so how's the first year gone?
It has been a fabulous year, it has been a rewarding year, and it has been a learning year. We started the Mental Health Care Works campaign with one goal in mind, to move beyond the statement, there is no health without mental health, and make sure that we start prioritizing our mental health, just like we prioritize our physical health. In the first 100 days of the campaign, we had achieved over 32 million audience impressions. We didn't even think that was possible in the history of the foundation with all the great work we had ever done. As I sit here today, we're over 242 million impressions. People want help. They want to find out how to get help, and we have to be there if they make the call.
Those are amazing numbers, aren't they?
They are amazing.
So what do you put that down to?
First of all of the APA enterprise. This is the first time they've ever said, we're all going to do some important work and we want the foundation to lead it. Two, we've matched an air game with a ground game. So what's happening is, not only do you see our public service announcements, you see our commercials, you see our social media, but we also do field events in community. And we've actually expanded our fellowship program so that we're able to work in community. So we're meeting the patients, we're meeting the family caregivers, and we're meeting the policymakers where they are.
So that's year one. How does it go from here?
So we're pivoting now. What we're really going to continue to focus on is awareness and literacy, so that our clinicians are not talking past our patients, and our patients feel like they're being heard and being a part of the treatment plan.
So tell us a little bit about the aims of the fellowship program.
So one of the things that I think is the hallmark of APA and the APA Foundation is that the future of the House of Medicine and our branch of the House of Medicine is only as good as we invest in it. And so we invest in a pipeline program where we bring resident trainees to a Vanguard program. We're celebrating the 50th anniversary of the APA enterprise hosting the fellowship program. We've gotten permission from both boards of APA and the APA Foundation to do the first major expansion of the program since the 50 years that we've been hosting. So we opened a community leadership program. And so we brought in 13 trainees, including Dr. Kim. They're in community, embedded in an experiential activity.
So Tina, how did you get involved in the fellowship program?
Yes, I heard about this great opportunity from one of my mentors, Dr. Sidney Hankerson at Mount Sinai. He said, Tina, we have this opportunity where you can work in a community clinic, which is the Hope Center Harlem for me, and you can be a community diversity fellow, which means I've networked with other trainees across the country, and we're working very actively on projects. So I'm on the school-based committee, which means we're trying to really make mental health, again, as Rawle said, really an everyday thing and start young. Both of those experiences have been really fantastic. I've learned a lot and I've met a lot of wonderful people. I think it's kind of the start of a great career and path for me.
And would you encourage others to get involved the same way as you have?
Absolutely. And you know, one of the things I really love doing was actually going to the APA Federal Advocacy Day. I think it's really easy as a trainee to kind of feel like a cog in the wheel. You're just learning the system and learning how to do it right. But we also have really valuable ideas to bring to the table. Right? We're on the front lines, seeing folks, seeing what works and what doesn't. And it was really encouraging to see that a lot of my ideas and a lot of my thoughts were taken very seriously. People want to hear from us. And I really encourage people to have their voices be heard.
Obviously, the foundation is doing some great work and having a major impact. What happens next?
So one of the things we've got to continue to do is get the word out that mental health care works. But I think as we pivot to action, we do recognize that there's still a growing number of people at all ages and at every stage who don't either know how to get help, they're uncomfortable or are scared to go get help, or don't think they need help. I can handle this on my own. And we got to continue to promote the campaign, but more important than anything else, particularly because of the work that we've introduced, where 988 is a core component, the helpline is a core component of everything we do. We're going to save some lives because of this campaign.
It's been an absolute pleasure to speak to you both, and best of luck with the campaign and the foundation in next year. So thank you ever so much. Thank you.
Thank you so much.
Thank you so much for having us.
Thank you.